Hashimoto's versus hypothyroidism. Are they the same? How different are they? How to differentiate between the two? These are some of the common questions that our patients keep asking us. Talking about hypothyroidism and Hashimoto's, when one is the disorder of the thyroid gland, the other one is the disorder of the immune mechanism. That is, hypothyroidism is because of sluggish thyroid gland, whereas Hashimoto's is because of a confused immune mechanism wherein it is attacking the thyroid gland, and which leads to reduced production of thyroid hormones, which ends up in increased TSH levels. So how do you differentiate between the two? Technically, since the thyroid gland is being affected in the end, the symptoms are more or less the same, like cold intolerance, delayed digestion, constipation, sluggishness, fatigue, dry hair, dry skin, etc. Something that we commonly observe in patients with Hashimoto's thyroiditis is that, being an inflammatory condition, very often these patients experience excessive warmth of their palms as well as feet, and there are some others who experience fuming of eyes, nose, mouth, and even crown of head, and this is because of inflammation. Talking about the treatment of the same, as per the Western medicine, it is all about supplementing the body with synthetic THYRONORM pill for both the conditions, and there is no medication for anti-TPO per se. But Ayurvedically, we try to understand what has caused the dysfunction at the first place. In hypothyroidism, very often it is a sluggish metabolism which is a causative factor. Whereas when it comes to Hashimoto's thyroiditis, we try to understand what triggered this kind of confused immune mechanism. Is it stress? Is it any other autoimmune conditions? Or are there other reasons behind it? And depending on the causative factors, if it's stress, we need to tackle the VATA imbalance that has been constantly triggered by stress, because stress triggers cortisol. Cortisol leads to fight and flight mode in the body, and this leads to VATA imbalance. So it is all about tackling the VATA imbalance, and that often takes time. And that is the reason why the treatment of Hashimoto's thyroiditis takes time, because first you need to take care of the inflammation, then the Tridosha imbalance, and then the long-standing VATA imbalance that has been triggered by the stress. So these are the primary differences between hypothyroidism and Hashimoto's. So which one are you struggling with?